Hey y'all, hey, it is me, it is your girl Nurse T, and welcome back to my channel. If you haven't already, go ahead and hit that subscribe button, and if you are a returning subscriber, hey y'all, hey. So anyways, I just want to address something today. Unfortunately, if you're from Houston, or if you're not from Houston, we lost one of our well-known rappers, Beatking. Alright y'all, so yes, we lost a well-known rapper. Unfortunately, he died in a very tragic way, a very spontaneous, to say the least, a way that is a very scary way to go. But it's a very popular way that a lot of people who suffer from this have lost their life. Me as a registered nurse, I've seen this before. I've seen this in action since I've been a nurse, where a patient would actually develop this while in the hospital. But anyways, let me just click this off. But anyways, y'all, so we all know, for those of you who don't, that he died of a pulmonary embolism. So I do want to take this time, because I did see on some of the pages that a lot of people are saying it was COVID related. They'll say, oh, that vaccine, or then you have some people that say, well, pulmonary embolism's been around before COVID, so it's not that, blah blah blah. And I'll just give my 2 cents on if I think it's related to COVID, or if I just think it's just something that just could have happened. Okay, y'all, so first of all, what is a pulmonary embolism? How is it formed, and what causes it? Yeah, so the first thing we will say is, the question we will ask is, what is a blood clot? Or how is a blood clot formed? We know what a blood clot is, right? And how is it formed? Where is it formed? Well, blood clots are usually formed in like the leg. The majority of the time, blood clots are formed in the legs. You can get blood clots in the arm. They could be superficial. They could be deep. So basically, if it's a deep blood clot formed like in the legs, we call it a deep vein thrombosis. Now, when that clot breaks loose and begins to travel, if it travels to the lungs, we call it a pulmonary embolism. It can also travel to the heart, and it can travel to the brain. So when it travels to the lung, the pulmonary embolism, it can block the flow of oxygen, which can lead to sudden death. I asked, well, Nurse T, what are some symptoms? How do I know that I'm at risk for, or that I'm actually experiencing a pulmonary embolism? Well, if you think you have any of these signs, or collectively have at least more than 1 or 2 of these, call 911. Don't try to drive yourself to the hospital. If you can, call 911. But common signs that you may experience is, number 1, shortness of breath, because obviously there's a blockage. Your lungs is not getting oxygen. There's a blockage in the blood flow, so you're not getting any oxygen, right? So you're having the shortness of breath. You're going to be having some rapid breathing, because obviously, you're breathing fast. Chest pain, of course, because your chest, your lungs are lacking oxygen, so you're going to have pain in that area, because where we don't have oxygen, we have what's called ischemia, which is a lack of oxygen, which causes pain. Typically, you'll have fast heart rate. That's your heart trying to compensate for, is your heart is working hard because you're not getting the oxygen that it needs, right? Sweating, the patient will be diaphoretic, right? The patient will be sweating profusively. Just, they can't catch their breath. They have chest pain. They have shortness of breath. They sweating. Yeah, so they might even feel like they want to faint. So those are signs that basically telltale signs, like something ain't right. Something must be blocking my flow of oxygen to my lungs. So 9 times out of 10, it's probably a a pulmonary embolism. Right. So Nurse T, how is this diagnosed? What can I expect? Like, how would they tell me if I have a blood clot? Well, I'm sure there's more ways to do this, but there will be 2 ways that I can tell you for sure. One is they'll do like a CT scan. CT scans are very quick. They can tell if you have like some type of pulmonary embolism, some type of clot going on in your chest. And then you have like a blood test they can do. They can do what's called a D-dimer. They can tell like your risk of clotting. And then they have other blood work, and they have other tests that could be done. I mean, they can do like if you have a expected or suspected DVT in your legs because you're having pain in your calf or whatever, they can do an ultrasound. They can check it. So there are ways to, like, when you have pain in certain areas that's not relieved, go get it checked out, because 9 times out of 10 you might have a clot there. Like I said, you can have a clot in your arm, which can cause swelling, pain. You can have it in your legs and your calf, which can cause swelling, pain, redness, warm to the touch. If you have it in your lungs, God forbid, it can cause shortness of breath, rapid breathing. It can even cause you some coughing, like, a lot of coughing, continuous coughing. And if you're coughing up sputum with blood, then that's a real big telltale sign. So yeah, those are some ways of how we can diagnose it. Okay, Nurse T, how is it treated? Okay, so if you can get to the hospital in time, especially with a large clot that's very deadly, if you can get there in time, they can. We normally start patients on what they call a heparin drip. So heparin drips can help prevent the blood clot that's already there from getting larger, and it can also help to prevent further clots. So we put them on what's called a heparin drip, right? And then they also have pills, anticoagulant pills that they give you. To name a few, you have patients that's on Plavix, Brilinta, Eliquis, Coumadin / warfarin. If I missed any, they're different ones they can start you on. Most popular ones they typically go home on, like I said, was like the Eliquis, the Coumadin, the warfarin, whatever. And when you're on those, when you go home with those medications, most of them have to be monitored. Like, they'll have to check. They can do, they can give you a thrombolytic to help basically dissolve the clot like quicker. They can do a pulmonary embolectomy. Basically, a procedure where they go in and actually surgically remove the blood clot. Or they can place an IV filter. So that helps to prevent you from being at risk for developing further more blood clots. I see these type of things majority in people that are post-operations. That's why, basically post-operative, like having surgery, after you've had surgery. So that's why they tell you to early ambulation is key. Get up and walk. When you've had these surgeries and any kind of surgery, you're laying there, your blood is pooling at your ankles, you're laying in the bed. That's why when you go to the hospital, they put you on some type of preventative anticoagulant, preventative what we call VTE, to prevent you from having any anticipated blood clots. Your nurse might come in with a heparin injection or a Lovenox injection, and they give it to you what they call sub-Q in your belly, and that's just to prevent you. A lot of people like to refuse it when they're in the hospital. Again, that's just one of the mechanisms that are lined up to help prevent. It's not a 100% thing. If it's going to happen, it's going to happen. But wearing your SCDs, your sequential devices on your legs, the one that squeezes your legs, along with your early ambulations, moving around, along with the the blood thinners, those combinations, those are things that help decrease your risk of blood clots when you're in the hospital. But yeah, usually after surgery, that's a high risk. Riding on the airplanes and you're not getting up, moving around, I would say hourly, get up, move around, get that blood flowing. If you sitting there in your seat on the airplane for a 4-hour flight, flexing your feet back and forward, just stimulating as if you were walking, keep that blood shooting up your calves while you're sitting there. I'm always afraid when I'm on a plane, and I'm always like trying to wake up out my sleep and remember, hey, I gotta move my legs around. But yeah, so after surgeries that you're at higher risk, riding on the plane too long, higher risk, being bed bound, not getting up, moving around, you're at higher risk. Now the question is, does this link to COVID? Have I seen these type of things a lot since COVID? I'm honestly tell you, this kind of stuff was happening before COVID, but I actually think the study wasn't done to justify what are the long-term effects. So we're the study. I feel like we're the people, we're the longitudinal study that's going on after this this vaccine was brought up. I see I waited till the very end until like my job was threatened before I took the vaccine. And unfortunately, I do regret taking the vaccine. Now, give or take, if I didn't take it, do I feel like when I got COVID, I felt like the vaccine did it decreased the symptoms that I've had. Like from the first time, it was probably worse. And then when you start seeing people continuously getting the COVID, this was during COVID time, I felt like the symptoms wasn't as severe. Like we had people dying from left to right during COVID. That was a scary time to be working in a hospital. But, I would say that after the vaccine, the deaths slowed down, and the length of time people were sick slows down, because they also came out with the medication, the remdesivir. But so I won't project my opinion on that vaccine to y'all, but I would just honestly say that I'm a little fearful myself because I took the vaccine, and I feel like it has I feel like I get a lot of shortness of breath more often since then. And I'm a person that work out, so I don't know, I have my ill will feelings about that vaccine. But yeah, so I don't want to be on here rambling, y'all. I did just want to come on here and just give my 2 cents. Again, I'm not a medical director. I am a registered nurse, and I just wanted to give my little education on when you need to go make sure that you're reaching out to your doctors, not taking it lightly. Don't sleep it off. If you're feeling chest pain, if you feel like it's crushing, it's squeezing and stuff, just go ahead and call 911. If you feel like you're in an area where they're going to take forever to come, don't drive yourself. Have someone else to drive you. But I can't even recommend you to get in the car without saying call 911. So call 911. But other than that, y'all drop any questions down below. Thank you for watching the video. Give it a thumbs up if you feel like it was helpful. And I'll see y'all on the next one.